Greetings from Citizen Health and the Team Academy IAPSME Connect. And today we have Dr. Shobha Mishra, who is a professor and head of Department of Community Medicine, PDU Government Medical College, Rajkot. A very warm welcome to you, ma'am, on behalf of all the audience.
Good afternoon, Ritu. I'm very happy to be here with you on this platform.
We are also very happy, ma'am, and today we are going to talk about the topic gender and health इंटरनेशनल वुमेंस डे सेलिब्रेशन. जैसा कि हम सभी को पता है कि अभी हमने रिसेंटली 8 मार्च को वुमेंस डे सेलिब्रेट किया है, तो आज हम उसी पे एक बात करेंगे कि किस तरह से क्यों ये डे मनाया जाता है और इसकी क्या इम्पोर्टेंस है. इज इट राइट मैम?
Yeah. Ritu, if we go back into history, then it was 1909 जब न्यूयॉर्क में ये पहली बार मनाया गया था, and ever since then it is celebrated as an International Women's Day. And primarily, there are inequalities. We will talk on it later. So that's why it is a way to celebrate the achievements of women in various fields of socio-economic, political and other developments, and to spread awareness on the women's rights and advocate for through various platforms to fill up the gender gaps. And every year, and the theme is there. Every year there is a theme, and this break the bias is the theme for this year. And so people work in different ways to celebrate this, and we chose this to as one of the platform today. And मेरा ऐसा लगता है कि I have my experience says कि women को secondary citizen समझा जाता है. मैं गलत नहीं हूँ उसमें क्योंकि कितना टाइम हो गया ना. It is a slow change which is happening, though our constitution has granted equality to women and there are women empowerment schemes also, and things are happening, but it's still in a very slow change. But I hope one day women will be inclusive in the world. एंड एक और बात ये है कि जो 1956 में एक बड़ा मूवमेंट हुआ था, when 20,000 women marched the union building as a protest against defining them as blacks. So that was one of the also a very important landmark for women putting their rights forward, their fit forward. Yeah.
So do you think that there is a difference in gender and sex, and why do you think so, ma'am?
See, gender and sex generally people understand as they are synonymous, but it is not like. If we talk of sex, it is the biological difference, the chromosomal, the anatomical and physiological difference. And in the common sense, we can say that the different reproductive organs that these two genders have, but this is not the same as gender. If ये बात करें कि कोई महिला है और जैसे women है, God has given them the power to recreate, to create, to nurture. वो एक डिफरेंस जो हमें चेंज नहीं करना चाहिए, हम कर भी नहीं सकते हैं. लेकिन यदि हम जेंडर की बात करें तो it refers to economic, social, cultural attributes and opportunities associated with being a men and women, and upheld by different societies at different points of time. जैसे कि तो if we talk of sex, it is male and female. But if we talk of gender, it is being feminine or being masculine. And it is not wrong to say that nearly all societies, they have a fault line division through gender. What I mean is, there are different worlds, different spaces, different differentials where women work and men work. The responsibilities and roles given to women, like they have to take care of the family and look after the old and sick in the family, purely a women's space. And on the other hand, men, they are to support the family. But this is good. But what happens is, because of this, the women have different access to and control over resources. So they become resource poor because their work is not valued. A housemaker, so those things, which makes the difference and which affects the lives of women and men, differently. And that's what we have to work on it, and a change has to be brought in.
So, ma'am, what is gender equality and equity? Gender
Yeah.
equity.
Okay, so I would take equity first. So gender equity means being fair to men and women, fairness in distribution of benefits and responsibilities to men and women. For example, we talk that women's status in the society. I think it's not equal. We are not getting equal conditions so that we can fulfill our human rights and contribute to the society in different manner. And it is not that we don't. They are not similar, as I said, the sex part of it, but those differences and similarities should be valued, that and recognized. That is what we need, so that we can show women can show their full potential and have equal status in the society. When we talk of equality means equal distribution, when we talk of equal distribution of all those benefits and opportunities among men and women, तो है ही, लेकिन it is based on gender roles and responsibilities. Gender norms have created them. That's why we need women specific programs, which is actually, if there was no difference, that would not be needed. For to bring in equity, we need equality through programs and policies.
So, ma'am, how is gender constituted? Social determinants of health and
Yeah.
how?
Yeah, so gender differences are not natural differences. They are, made by the social structure. And if I say that they are taught systematically, boys and girls are taught systematically to be boys and girls, and this happens very early in life. जैसे लड़की को फ्रॉक पहनना है, उसको गुड़िया से खेलना है, बॉय को एक प्लेन लाके देंगे, उसको डिफरेंट ड्रेसेस है, डिफरेंट वे दे विल बिहेव, डिफरेंट उनका बिहेवियर, कोई घर में आए तो बॉयज का तो हम खुद उसको प्रमोट कर रहे हैं। और बड़ा रोल फैमिलीज का, कम्युनिटीज का, स्कूल्स, वर्क प्लेसेस, to name a few, and women, I will talk of women. Women are the perpetuators of this most of the times, into these, we push our children into gender roles. तो उसमें क्या हो रहा है कि the main cause, there are many causes, but एक है सन प्रेफरेंस कि लड़का होना चाहिए। इसीलिए हम एक सर्वे ने अभी ही बताया है कि जब मेन और वुमेन को पूछा गया कि वो डॉटर्स चाहेंगे और वुमेन को, तो देयर वर वेरी negligible percentage saying, men and women saying that they need daughters. It was Mizoram and Meghalaya, those है स्टेट्स में अच्छा रिस्पॉन्स मिला, पर जनरली इन ऑल सोसाइटीज, एंड इसका फैमिलीज में ज्यादा हो रहा है, क्योंकि फैमिलीज में क्या है, स्मॉलेस्ट यूनिट ऑफ द सोसाइटी। दूसरी चीजें वर्क प्लेस एंड ऑल दैट, दे आर बीन ऑब्जर्व, द फैमिली इज नॉट ऑब्जर्व, सो व्हाट हैपेंस इज टू पुश चेंजेस through policies in the family becomes difficult. Like if I talk of sexual harassment at workplace, तो दिखता है, रिपोर्ट हो सकता है, लेकिन डोमेस्टिक वायलेंस का क्या, जो कि फैमिलीज में होता है, 5 में से 3 लेडीज बोलेंगी कि इट्स ओके दैट वी आर बीटन विद द वाइफ हस्बैंड्स, कि हमने खाना ठीक से नहीं बनाया, हमने इन लॉज को, सो इट इज द women themselves, they should come out with all this. So this is what the social and these are also shown in the programs and policies. There are differences, so institutionalized, legitimated through the programs and policies as well. मैं ये नहीं बोल रही हूँ कि even men are constraints of masculinity. जैसे अभी तो ठीक है, विमेन पायलट होते हैं वॉज, पर पहले के पायलट्स है, वॉज में जाना है, men cannot cry, तो वो दूसरे प्रॉब्लम्स उससे रिलेटेड, एडिक्शंस, नाइट ड्यूटीज, so they also have their due differences based on these responsibilities and norms which society makes. So the men should also come forward, so that our society is inclusive. And So it is constructed through the, and these I say that कि ये ideology है, यदि हमें इसे change करना है तो we have to change the ideology which upholds man and as more powerful and women as less powerful, and it is institutionalized through various institutions also. So and it these are and one of the determinant of health is gender. Now one of the determinant, social determinant, is gender. So gender are socially constructed based on the social and economic setups, and the biological differences are there, but the society makes the difference. So which is a matter of injustice, matter of justice and equity, and it is not that they cannot be changed. They are all amenable to changes if there is political and social will through political and social institutions. If they want, these changes can even have a, yeah, they can be changed.
So that is my next question, ma'am, that we are talking about health on this platform. So how do you think that gender affect the health?
See, if I give you some examples of inequality, like going into the World Economic Forum data and data all over the world, and here I will specifically talk of India. So if देखा जाए तो they a number ही कम है, 66 crore women versus 70 crore men. Isn't that a difference? God doesn't, God sends men and women equally. So why this difference? The literacy in women, which is 65% versus 80%. The dropouts in the schools, how the girls drop out very far because they have to get married. The dropout in boys is less. Another thing you see, वैसे तो women की death rate ज़्यादा कम है men से, 6.5 per thousand population versus 5.6. तो ये जो है भगवान ने तो they have given a power to live, but the society makes a difference. Maternal mortality rate, अगर mother यदि pregnant होती है तो उससे क्यों मर जाना चाहिए? It is a physiological process. So why mothers are dying? There are social factors involved. Sex ratio 911 versus 1000 males. Isn't that a difference? Why it is happening? Why more women are dying during reproductive age group? They are living more than men. अब life expectancy देखा जाए तो ज़्यादा है. Then we see malnutrition in females and male. Anemia का example ले लो, जैसे men में 30% है तो women में अभी भी 60% anemic है. तो girl child, that survival of the girl child, पहले तो feticide से बचे, infanticide से बचे, and then the differentials in care given to her. So all the life cycle of women, there are social factors involved. So उसमें क्या होता है? Because of this, there are different risk and vulnerabilities. If we compare men and there are different perceived needs for healthcare and the type of treatment, access to and control over resources, then the consequences of ill health. So these are the things where we need to work upon. And what happens, it is the gender doesn't work in isolation. It is one of the social factor. Poverty and other things are there as social factors, but this is added to what are the social differences. And what happens is, because of this, the life of women is different than most of the women, I will say. And it is not so we need a multi-pronged strategy. एक single strategy नहीं, intersectoral coordination among different departments to work with the social institutions. So we need to join hands there. And इसके कारण क्या होता है कि because of these factors, the status of the women in the society, एक दूसरा मैं बोलूं कि वर्क डिस्ट्रीब्यूशन है तो विमेन की वर्क को तो कोई अहमियत ही नहीं है. हाउस होल्ड वर्क कर रही है, पैसा तो कमा नहीं रही है, तो दैट वर्क जिसमें गांव में देखो तो 2-3 किलोमीटर चल के पानी के बटके लेके आ रहे कंधे पे, इंडोर पोल्यूशन है, यदि गैस नहीं ही है, तो ये सारी चीजों से यही चीज यदि फैक्ट्री में हो रही होती है तो इट इज लॉज आर देयर. बट व्हेन विमेन इज वर्किंग एट होम, these are not the hidden things that is happening. इसके कारण कई बार क्या होता है कि अनरिकग्नाइज सेक्टर्स में काम कर रहे हैं वो लोग, 40% हस्बैंड के कल्टीवेशन में उसके साथ काम कर रहे हैं, तो उनका जो रिसोर्स है वो उनके लिए है वैसा उन्हें नहीं पता है, और यदि है भी तो उसको कैसे यूज करना है, यदि घर भी है तो उसको कैसे यूज करना है, पैसे हु डिसाइड्स, मोस्ट ऑफ द टाइम इट इज द मेन, एंड इवन द नंबर ऑफ रिप्रोडक्टिव राइट्स की कितने बच्चे होंगे, ऑल प्राइमरी द वीमेन कैन नॉट, मोस्ट ऑफ द वीमेन कैन नॉट डिसाइड कि कितने बच्चे होंगे, कब शादी करनी है, कितना गैप रखना है. लिटरेसी एंड एजुकेशन इज द बेस्ट वैक्सीन, आई विल से. पैसा नहीं है लेकिन एजुकेटेड लड़की है तो गर्ल एजुकेशन में इन्वेस्टमेंट बहुत हेवीली होना चाहिए, ड्रॉप आउट्स वगैरह कि मिनिमम स्कूलिंग पूरी हो, राइट एज पे शादी हो, तो इससे क्या होगा कि वो घर का अच्छे से ध्यान रख पाएगी, हेल्थ का, न्यूट्रिशन का, कम बच्चे होंगे, इन्फेंट मोर्टेलिटी कम होगी, एंड ओवरऑल हेल्थ ऑफ द, इवन इफ शी इज नॉट वर्किंग एल्सवेयर. तो दीज आर सम ऑफ द, एंड देन न्यूट्रिशन. आप देखो कि मैलन्यूट्रिशन है, एनीमिया क्यों ज्यादा है. कई घरों में मैं तो देखे हैं जहां पे विमेन इज द, गर्ल इज द लास्ट टू बी फिट. पहले मेन और बॉयज को खाना, फिर बच्चा, यदि बच्चा है तो हस्बैंड की थाली में बच्चा हुआ खाना, all what happens is then malnutrition and other and then she has to bear children in that reproductive age group. So I feel these are some very grave consequences of then no affects the health of women.
And ma'am, is there a gender bias in medical education and health setting?
Yeah. I will, yeah, sure, I will talk about it. अभी देखो तो ये बुक्स जो है, ठीक है, बुक्स है, मेडिकल बुक्स है, तो we need gender segregated data. For all data should be segregated as male and female. We don't get much data. तो एक तो बुक्स एंड शुड एड्रेस दीज प्रॉब्लम्स. एंड देन फॉर एग्जांपल ऑस्टियोपोरोसिस है, एक बीमारी ऑस्टियोपोरोसिस है, रूमेटिक हार्ट डिजीज है. यही डिजीजेस मेन में होगी तो लेस सीवियर होती है और विमेन में मोर सीवियर होती है और प्रिवेलेंट भी ज्यादा होती है. तो दीज डिजीजेस नीड टू बी लुक्ड एट डिफरेंटली एट हेल्थ केयर सेटिंग. अनदर थिंग आई कैन से HIV की बीमारी है, तो देर आर सोशल फैक्टर्स aggravating the problem of women, because it is a behavioral problem, the route of transmission. So the women are the sufferers. They will be thrown out of the house, or then their survival also matters, and she will not be treated. Most of the time we have seen she will not be treated as par with men who are having HIV, and the culprit that she is the one who spread the there can be various other reasons. So these small things, I mean, these are the areas where there should be equal treatment of men and women, and there should be specific programs for women if there are differences in the availability of programs and policies. So, and so I will say that we should have a gender eye, look at these problems ethically as gender issues and address them on a scientific and cultural platform.
Very true, ma'am. Any take-home message? Please give any message to all the audience to just to bring an equality between these gender biased society.
So I would like to say, those pretty women all who are watching this, that first thing, I'm an empowered woman. I can say I'm autonomous as well. I'm fortunate maybe, but most women are so I first thing कि आप अपने आप को love करो, respect yourself. When you do that, you set a stage where others will respect you, and when you respect yourself, your self-esteem is enhanced, your confidence is enhanced. So these are our internal resources already we are having. And even support other women. Unless we support other women, we should empower other women by small donations or any support, kind of support they need. And men's support is equally important for women empowerment. God has given the great, qualities where we are nurturer, care, we can transform anything that we like. And I think we don't need a special place in the society, but let us have a due space in the society. So go out, take a time for yourself, and to a point that you feel glorified, dazzled, celebrated and awarded. Don't wait for anybody else to appreciate your award. You award yourself with small, things that you do in life, small achievements. Celebrate them each day, and have a as I said, women are the perpetuators also. So try to bring in change there. Change आ रहा है, ऐसे नहीं है. फिर कई बार क्या होता है कि एक लड़की होती है तो दूसरा करना है कि लड़का तो होना ही चाहिए, लाइक ना, वो भी एक इशू है जो one needs to think of. Yeah. Anything
Thank you
else
so
if you
much,
want?
ma'am. It was really nice talking to you. It seems that बहुत ज़रूरत है सोसाइटी में ये मैसेज देने की कि अभी भी हम बराबर पे नहीं आए हैं. ये मैसेज ज़रूर जाए लोगों को, और आई विश कि अब कम से कम इस बात से शुरुआत करें कि औरतें घर की खाना खाने की अंतिम सदस्य ना हो. They should not
Exactly.
be the
Exactly.
last
They should
person.
be the first person. They need nutrition.
True. Thank you so much, ma'am. It was really nice talking to
Yeah, I
you. And
also enjoyed. Thank you, Ritu.
thank you,
Good
ma'am.
day. Good day.